Every day, sheriff's departments across the state come in contact with people experiencing extreme mental crises. And what this virtual crisis care program does, it gives the sheriff's departments tools to better handle the individuals and de-escalate the situation and make the right choices out in the field.
So what does it look like? Sheriffs or someone with the police department will go out, come in contact with someone who's in a mental health crisis, and what happens after that?
What happens typically, the sheriff department and the city police departments are given these iPads that are loaded up immediately to a trained team of interventionalists. These people have different qualifications. Some are psychologists, some are other trained folks in the mental health field. And at a touch of a button, after the situation is de-escalated, they give the iPad to the individual, and the mental health team then interacts face-to-face with the individual on scene, at their own home sometimes at a police station, wherever the crisis is occurring. And the mental health team can talk with the individuals and come up with a plan. Sometimes that plan might be taking the person to a mental health care facility. Sometimes it's more de-escalations and tying them into care within the community. So it's a great tool for the police department where traditionally the decision whether you go to a mental health institution, voluntary or involuntary, was made by the police department. Now the police department has a tool to use trained individuals who are experts in mental health to help make those decisions.
You have been a police officer yourself. In your opinion, is that a decision a police officer should be making, whether to take someone to a mental health institution?
Well, it's not necessarily a decision that they should be making. They have to make that decision because it's a life safety issue. And at 2 o'clock in the morning, there are no other services, especially when you even get into rural areas. Sometimes during the day there isn't any services. But the police officers, and I can say because I was one of them, don't always have all the training and the knowledge to make those split-second decisions, but they have to make it. So they tend to err on the side of safety and generally transport people to these facilities where they might not need it.
And where were you a police officer?
I was a police officer in Sturgis, South Dakota and Mitchell, South Dakota for about 10 years.
And so you were working in rural areas mostly?
Yeah, very rural areas. Sturgis, South Dakota was about 6,000 people. Mitchell was a hair bigger, and we had contact with people having mental crises back then almost on every shift.
And I bring that up because this program focuses on rural areas only. And when you announced this $3.8 million grant from the Helmsley Charitable Trust, there were a couple of Nevada law enforcement officials who spoke about the need for a program like this, what they're currently facing. Let's take a listen.
Our problem, just a little bit about Lincoln County, is we're almost 11,000 square miles. So we're 3 hours from Las Vegas, 7 hours from Reno. So if we're going to go get any services, and that's one direction, that's one way, if we're going to go get any services, I mean, you can see that it's huge for us. And right now, if we have a person that is L2K'd for a mental evaluation, I could be taking my one and only patrol officer off the street to do a 6 to 8 to 10 hour transport. That's if there's no issues at the hospital. We've been turned away before.
Because we don't have a full spectrum of resources available, a lot of times it's the lowest common denominator. If we have to take someone to a hospital, it could be an ER room nurse that does an evaluation on someone. Again, they're busy people, they're not specifically trained in this, and they don't spend the time to kind of build the rapport with these folks, learn about them, and get the true story. And unfortunately, we've had people who are taken for evaluation, they're held for a short period of time, there is an evaluation that occurs, but they're then released from the hospital or another provider, given a single sheet with some other providers here in the area and told to reach out and schedule an appointment. And unfortunately, they will go home and complete a suicide.
It's such a sad scenario. And you had talked about the decision whether to take someone to a mental health institution, but there really aren't many of those. So you often are going to hospitals that are not equipped for this type of issue.
Exactly. A lot of times the initial contact may be in the hospital. The hospitals generally aren't equipped with mental health care teams. Some of them in the larger cities are, but the majority aren't. So it really puts a strain on the entire community and the patient too, because the individual having the crisis isn't being seen in an adequate time.
And it can put a strain on the jails as well. But if someone is committing a crime, they are going to get arrested, correct?
Absolutely. This isn't taken away from people that are committing crimes or anything. Those people will face the justice system. I like to say that mental health, if someone's in a mental health crisis, that's the only health care condition that you can be arrested for and put in jail. Just think about that. You don't go to a jail for a heart attack. You don't go to a jail for a stroke. But a lot of times, these people end up incarcerated for just having mental health problems.
Some of the officers that we heard from and the sheriff's office spoke about the crucial aspect of this is it's not just that initial call. That initial call, who is answering that on the iPad?
The initial call, it's a team out of South Dakota. It's called Avel. They're a telemedicine team, and they're a team of physicians, doctors, nurses, other types of clinicians, psychologists. Those are the types of people that are answering that.
And so it's in South Dakota, but then the follow-up, that has to be local, right?
The follow-up is 100% local. The reason they were selected, first of all, it was done with an open bid with the state, but they have the qualifications. They have run this program in South Dakota. They are one of the largest telemedicine providers in the nation.
Wow, and so it's a pilot program in South Dakota. How well did it do? Has it done? Is it doing?
It's still ongoing. It's actually expanded in South Dakota, which is super exciting. And just to give a little perspective, out of all the encounters, 80% of the individuals having an encounter with a mental health encounter with this iPad program do not get transported to the hospital.
Wow.
They have care found in town. So that's huge when you're talking about saving resources for the communities, saving the time of a deputy, making many hours of transport, and the people are getting treated at home, which is huge. And the follow-up on that, they have seen 50% less recalls. So there's 50% less recidivism calls of the same individual getting help, needing help. So this means it's working.
And perhaps that's connected to that crucial follow-up aspect. Last question, how was Nevada so lucky to get this pilot program?
Well, this has been great for Nevada. Nevada actually came to the trust. Folks from Nevada heard about what was going on in South Dakota and expressed interest. And that's when my team started and myself started dialoguing with the state. We started off with, of course, with the governor's office, Governor Sisolak, Chief Justice Hardestein, who expressed very strong interest on this program, and even talked on the local areas. We were very happy that Sheriff Lombardo saw very much of a need for this type of program in the rural areas of Clark County. Most people don't think Clark County has rural areas, but you get out towards Mesquite, you get out towards Boulder City and Indian Springs and stuff like that, it gets very rural very quick.
Still areas that Metro has to oversee.
Still Metro oversees. So we got buy-in from across the state, and that's the key thing. This isn't just a Republican, a Democrat thing. This isn't a, small town, big town thing. This is a problem across the state. And everybody's seen that this could be one of the answers to the problem. This isn't a magic silver bullet that will end mental health care problems, but this is something that's going to actually move the needle and make a difference for especially those people who choose to reside in rural Nevada.
It is a start. Walter Pansier, thank you for coming on. We are going to have you on Nevada Week in person on September 17th at 6:30 p.m. We'll be talking about the trust that you oversee, the Helmsley Charitable Trust, which is connected to your infamous grandmother, Leona Helmsley, nicknamed the Queen of Mean by the media, but I imagine you have a different perspective. Look forward to that. Thank you for your time.
Thank you.